Nancy Home and Mary Haynes. I'm the president here, and we're happy to have you on these dog days of summer. We actually just completed the dog show out front. Some of you may have come in while that was going on. And WHAS was here filming, so check that film at 4, 6, 10, and 11 on WHAS. So at Nazareth Home, you know, we have two campuses. We're in the Clifton community, and we are very devoted and proud of what we do. We've been serving the community since 1976 here in this location, and we have absolutely every sort of care that you think about when you think about what happens when we're not able to be at home. So again, we're proud to be doing what we do. Every year, U.S. News and World Report reports on the top 10% of skilled nursing centers across the U.S. We're often in that. We were in it again this year, and we're always proud to say that. We do that because we think we have the best workplace in town. And each year, last year, we received that recognition from both Business First and the Courier Journal, because we know that for us to deliver the relationship and human product that we do, we have to have the best team around, so we're grateful for that. So we've been offering this community education series since January. It's our goal to be a friend to the community. We know that we know some things from all of our interactions with people like you. We learn from every family who honors us with their time and attention. We learn from those conversations. So in that learning, we've developed this agenda for these 12 months. Today we're going to hear about sleep. That was on everybody's list. Now you are being filmed, so if you say or ask anything or tell any secrets about your sleep, you are going on video, just to let you know that. But sleep is very important to our health. We started this lecture series with Dr. Jane Theobald as she talked about the brain. And in talking about the brain, obviously sleep comes up, that rest that we need. So we're honored today by Scott McClure and his team from the Norton Healthcare group and their sleep center. So Scott McClure is actually a respiratory therapist, has been for 40 years, and he's been with Norton for 30. So I've been here 20, so we look pretty good for all that service, right? Yeah. So Scott's been the director of sleep services since early 2012, and we're happy to learn from him. So I see that he has a packet in your seat. At the end, we do ask for you to complete that survey, letting us know what else you would like to hear from the community of healthcare professionals that honor us with their time. So welcome, Scott.
Let me turn this on. Can you hear me? I have a pretty big, booming voice, and my wife yells at me all the time to be quiet. So I hope that I'm not too loud today when we go through our discussion on sleep. So thank you so much for your introduction, and I really thank Carrie for thinking of us to come and offer a discussion on the topics of sleep. Rest assured, the power of sleep. There is power in sleep. You know, it has so many purposes for us. It rejuvenates us. It assists. It's a little hot, isn't it? The mic.
Cool off.
No, I mean the mic.
I'm gonna do this.
Yeah. Okay. That's better.
Yeah.
Can you still hear me?
Yeah.
All right. But sleep is so important to us. Let's see here. So why sleep is important? I don't want to stand in front of the screen, but hello there. You're late. No, I'm just kidding. No, I'm just kidding. One thing I want to mention, I see some people that I know that have worked at Norton Healthcare. Big shout out to you all. Thank you for being here. This is wonderful. But why sleep is important? You know, we live such busy lives. And in the heyday of working and raising children and all that, we're all over the place, and it's so busy and hectic. Well, as we get older, things kind of slow down. We're not as pressed for time. But what you see here, many times we give up sleep to do other things, and it's tempting to do that, but sleep is precious. I mean, it really is. We have to sleep. I mean, the lack of sleep impacts our life every day. And if we're not getting sufficient restorative sleep, we're not going to be at our best, regardless. So, what you have to realize is that studies have found that insufficient sleep increases a person's risk for developing serious medical conditions, stroke, heart attacks. It increases our weight. You're at risk for diabetes or to have an uncontrolled diabetic situation, as well as the cardiovascular disease. And it will shorten your lifespan if you're not getting enough sleep. There was one note I wanted to mention. It's pointed out that missing a night's sleep is not that impactful. We all miss a night of sleep every now and then, right? You have certain things going on and you can't relax and you just can't get to sleep. Well, that's fine for one night. You can make that up. But if it's a long, continuous periods of time, that's when it really impacts your life and can impact your health. So what we want to do today is to go over a lot of things about sleep, how our brains operate in sleep to some degree, the things we test for in our sleep laboratories at Norton Healthcare that can really impact sleep, as well as different sleep disorders that everyone suffers with. So a couple of the things how that sleep dramatically impacts is our weight. It impacts how we regulate our hormones. It impacts our heart, our immune function, and then in turn, you're susceptible to other things like colds and stuff. So as far as obesity goes, people who sleep 6 hours or less a night on a regular basis are more likely to have excess body weight. As far as diabetes goes, fewer than 5 hours of sleep per night, you have a greatly increased risk of having or developing type 2 diabetes. For cardiovascular disease, you're at 2 to 3 times higher propensity for a stroke or a heart attack if you're not getting enough sleep. There's also hypertension as an issue. For individuals that have uncontrolled obstructive sleep apnea, for example, you're at a high risk to develop hypertension because we'll get into that, tell you about that in a little bit. Our immune function. Our bodies need that sleep to be able to heal cells that are broken. When we're sick, we need the rest. That's why our physicians tell us, rest and drink plenty of water. Well, you need that rest and you need sleep because in certain sleep stages, there is an opportunity for our bodies to start healing and whatnot. And again, the common cold. If people don't sleep on a regular basis and they have poor sleep, you're at a higher risk for getting just a simple cold. So our immune systems are dramatically impacted by the lack of sleep. So, let me try to read this. Sleep not only affects our health, it affects our moods too. So, sleep in your mood are closely interrelated. If you don't get enough sleep, you're going to be more irritable and moody. And then the flip of that is if you're irritable and moody, you're not going to get enough sleep because you're like angry, upset. There's the old adage, and I know some of you have heard this, like, don't let the sun fall on an argument with your spouse. Has anybody ever heard that? Right? That's the craziest thing you could ever do in your life. You haven't had any sleep, or your spouse hasn't had any sleep, and you want to have this big row about a topic. Well, if you're irritable and moody, that's not the time to have an argument, or at least with my wife. But it's really important to set aside times when you're both rested and level-headed and thinking appropriately to discuss those things. So I don't encourage people to stay up till the middle of the night to discuss those types of situations. And for those individuals that have poor sleep habits, you are certainly at a risk to develop anxiety and depression. You're at a higher risk anyway for that. So, sleep affects our safety. So, a third of adult drivers have reported driving drowsy or falling asleep at the wheel. That's dangerous. The most recent research that I've looked at shows that 20% of all motor vehicles are caused by drowsy driving. So, 1 million crashes, 500,000 injuries, 8,000 deaths each year in the United States because of sleepiness or drowsy driving. Now, driving's not the only thing that can be negatively impacted by lack of sleep. You're using power tools. You're climbing on a step ladder to get up on something. If you're sleepy and tired and irritable, or not concentrating because you haven't had enough sleep, you may step incorrectly on a ladder, you may fall, you may cut yourself with a saw or something like that. So it's important to really take seriously the need for sleep. The beauty of sleep. Oh, everybody sleeps, right? Babies need sometimes up to 18 hours of sleep a day. And as they get into the 6-7 months old, they need 10, 12 hours of sleep a day. Toddlers need at least 9, 10 hours of sleep a day. Teenagers, boy, when you're a young teenager, it's reported that you need like up to 9 or 10 hours of sleep a day. But then by the time you get to like 17, 18 years of age, you're getting only about 6. And all of it, as far as children goes, not getting enough sleep and being tired in school, those are their formative years. It's so important for those individuals to have a good night's sleep because that's when they're in school and they're learning, and that's why it's so important that sleepiness is taken seriously and getting a good night's sleep and sleep hygiene. But what about when you get a little older? What happens to us? Well, the experts tell us that we're supposed to sleep at least like between 7 and 9 hours a night. How many people are getting 7 to 9 hours of sleep a night? 2, 3, 4. Just a few. It's hard. It's hard. So what we want to do is we want to talk about, as we age, what happens to us when we sleep. Because aging is not for the faint of heart, is it? It's difficult. So, what happens to us? Is the right one? Yeah. Skin. What happens to our skin? We develop wrinkles. Our body no longer replenishes the cells as it used to when we were younger. There's a reduction in collagen in our skin, so that it doesn't snap back like it used to, right? So you start, what the heck is this? I'm getting this chin thing going now. I don't understand it, but that happens. You get this. I don't understand that either. Why is that? It's because our skin is changing as we age. The collagen just not snap back like it used to. So this elasticity is just getting, weaker and weaker. Hair. We lose pigment. The pigment stops producing in our hair. So what happens? We start losing our hair color and it just turns white. As my beard and my hair is showing, I'm getting there too. Energy levels. We don't have as high of energy levels as we used to. Who loves to take a nap? I never thought I would be one of those guys that says I love to take a nap. I love to take a nap. Muscle mass. We lose muscle mass. It says we lose about 7 pounds of muscle mass every 10 years. But it's really because of inactivity and not doing things that, pushes those muscles. And then there's what's on the outside, on the inside. Those like skin and hair loss and wrinkles, all that stuff's happening inside too. So we're not producing hormones like we used to. Our digestion slows down. Our organs just become less effective and weaker. We talked about muscle mass loss. Well, there's bone density issues. Our kidneys, there's a reduction in filtration, so they're not filtering what we drink anymore. And there's also a completely internal thing that we need to look at, and that's the clock. The good news is we live longer, quite a bit longer. So 50% of people over the age of 85 live independently, but some of us don't. But with age comes additional issues that we're contending with that we didn't used to have. Knee replacements, hip replacements, my shoulder's been replaced. I was talking to my in-laws the other day and they said there's a titanium club for people that have had stuff replaced. Oh, okay. So along with what's happening in our bodies, our sleep patterns change. Owl to lark. What's an owl? An owl's up all night, right? You're more alert at nighttime than in the morning. Well, that changes. Usually, what we're seeing is that people are transitioning from this owl that's more alert in the evening and at night, and they migrate to the lark phase, where they get up early and they're more alert in the mornings and they get a lot done in the morning rather than in the evening. What would you consider yourself, an owl or a lark? Owls. Who gets up in the morning? Just jumping, carpe diem. How about owls? Who wants to ease into the day and they get more done in the evening? Yep. So we're all over the place. And when we sleep changes too. So our sleep stages all change as well. So when we sleep is bed before 11 p.m., up before dawn. In many situations, not all, but as you get older, jet lag impacts you a little more as well. It's a little harder to deal with those jet lag situations. And then how well do we sleep? Well, what we find is that there are 5 stages of sleep. There's 1, 2, 3, 4 in REM sleep. So 1 is when you're kind of drowsy, you're just kind of drowsy and drifting off. And then 2 is more of a middle of the road sleep And then there was 3 and 4 years and years ago, but the Sleep Society or the physicians that oversleep, they kind of said that those two things would be kind of compressed. So there's 1, 2, 3, and then REM. So what there used to be 3, 4 is now 3 stages of sleep and then REM. So there's an increase in stage 1 in patients that are of age. And that's less than stage 3 and 4. So you're not having these deep states of sleep any longer, you're having lighter states of sleep, so you're easier to wake up. REM sleep dropped about 2 to 3% from middle to older ages, when we should be sleeping about 25% of the time in REM sleep. That drops to like 20, 21, 22%. Sleep efficiency drops. Sleep efficiency is you're in bed and how much sleep that you sleep during this period of time. So about 86% of sleep is the normal sleep when we're younger, but about age 45 to 79, that dramatically drops. And and it's a great deal less. We have increased arousals. People are having, they're waking up from their sleep quite a number of times through the night. So this all means that the bottom line is that staying asleep becomes more difficult. You're sleeping less time, and you're less efficient at your sleeping time. But we're more sleepy as we age. We're less sensitive to light, sound, and touch. So we stay asleep until we are aroused, and then we wake up. There's a fact that young adults spend about 95% of bedtime asleep. By age 65, sleep efficiency is less than 80%. 15% of the time you're not even awake. So let's talk about some of the things that really go wrong. Lifestyle issues. Our biological clock is shifting. We're no longer healthy eating or eating healthy. Our exercise habits fall away. Especially if we're living in assisted living facilities or skilled nursing facilities, we're not exercising as much. We retire, so there's none of that 9 to 5, so we don't have this regimental lifestyle anymore. It's like, I can sleep whenever I want, I can wake up whenever I want, I can do whatever I want. But you don't have that regimental lifestyle anymore, so that changes. The kids leave home, you don't have any responsibilities, and at that point, where you hope they leave home, right? So you don't have to be on top of someone else, it's just you. So you're just responsible for you, and you, again, make your own decisions and sleep when you want, wake up when you want, and run around and do whatever you want. But all of those things have a profound psychological effect on your daily regimens. So you're not as likely to get up early, work the day, go to sleep at a reasonable time, and get up and start the day again. So you don't have that regimental balance in your life that you once had. So the biological internal clock ages as well. There are chemistry in our bodies that during the daytime surge. One of them is cortisol. As that surges during the daytime, we become more alert. And as it drops off, melatonin drops during the day and then picks back up at night as it starts to get darker. Now, when we were an agrarian society, we were farming, right? The crack of dawn, we'd wake up, and when the sun was gone, that's when you were like, you come back to the house and you tidy up, you eat dinner, and get your bath, and go to bed to start it all again. Well, we don't have any of that anymore. There's artificial lights, And we're less of an agrarian society than we used to be, so we really rely on that clock. Well, sometimes when you shift this clock around and you're changing your times that you wake up, that you go to sleep, that clock becomes broken. So it's kind of, we do it to ourselves because we change how we set our daytime schedules. So there are several sleep disorders and issues that affect the aging. And there's cognitive impairments, there's insomnia, there's restless leg syndrome, periodic limb movement disorders, napping, and I don't have one there. I don't have one there, but we'll be talking about it. So as far as cognitive impairments go, there's Alzheimer's and other types of dementias. Now, I am not an expert by any stretch of the imagination. There's any neurologists in here? Come here to help me if you are. But there are organic brain disorders, so you have this loss of memory and other cognitive behavioral changes. There's sleep fragmentation, increased waking and wakefulness. So for individuals with dementias or other psychological disorders or organic brain disorders, they don't sleep very well because their sleep is so broken up. That's what sleep fragmentation means. They suffer from sundowner syndrome. The sun goes down, there's this confusion that the body goes through, that the mind goes through. And it's possibly tied to disruption in normal body rhythms, back to that clock. So what we have to do is we have to focus in what they call sleep hygiene, making sure that you're doing everything every day in a regimental fashion as far as your sleep goes. So we tell people to go to sleep and wake up at the same time every day, regardless of what's going on in your life. So even on the weekends, if you need to be up to work at 8:30 or whatever, or 7 o'clock or whatever time you wake up, you should do that pretty close to that time, even on days that you're not working. So it's important to keep a regular, sleep cycle. The other dementias include, of course, dementia with Lewy bodies. There's vascular dementia because of the blood flow to the brain, Huntington's disease, and Crutchfield James. And as far as Alzheimer's goes, treatment revolves around addressing various sleep-related problems. So we look at the problems that individuals that are having these types of issues are dealing with. So we deal with the insomnia and the fragmented sleep. There are things we can do for that. We deal with the excessive daytime sleepiness. We work on really creating a strong daytime awake circle or circadian rhythm. There's excessive motor activity throughout the night. Those types of things are what we work for and to try to fix. Treatment types address medical psychiatric issues. There's pharmacologic and non-pharmacologic things that we can do. Some of the things that we do to treat these symptoms are focusing on proper sleep hygiene, having a strong regimental process for when it's time to go to bed. We limit caffeine. You don't want to take any stimulants right before you go to bed, so you shouldn't be drinking coffee before bedtime or other stimulants, our medicines. A lot of the medications we take as we get older have stimulants in them or have stimulating factors that impact the central nervous system. Increasing exercise helps. So it's important to exercise at least 2 to 3 hours before going to bed. So if you get on the roller or you get on a stationary bike, you shouldn't do that too close to bedtime because that can impact your sleep. And then there's behavior modification, and that's working with a psychologist to help really kind of tune up your sleep hygiene and your process to go to sleep. So some of the sleep disorders that we see in our sleep programs, this is by far number one. Everybody has sleep or has insomnia at some time or other. W.C. Fields said, the best cure for insomnia is to get more sleep. Can you imagine you're laying there looking at that clock, you're going, I gotta get up in 3 hours. You cannot go to sleep. You cannot go to sleep. So what do? You lay there. Then you look at the clock again. It's 3:10. I've got to go to sleep. That's the last thing you need to be doing is staying in bed. So there are two types of insomnia. There's a primary insomnia. There's no reason why you can't go to sleep. And then there's a secondary type of insomnia. Because you have something going on with you. My hip hurts, my back hurts, my legs hurt. I can't breathe. So there's a cause to the fact that you're having trouble breathing. So and then let me see. So the things that impact us on insomnia when we have insomnia is like life stressors, children, school, work. Your loved ones aren't well. You have health problems. Your partner has health problems. And then there's chronic insomnia, which again is like this chicken and egg thing. If you have insomnia, you end up becoming more anxious about it, and then you're depressed about it. Well, you're anxious and depressed, which leads to more insomnia. So it's really important to try to arrest all that and to put it to bed, so to speak, and to treat those symptoms. Most of the treatments for insomnia really focus on sleep hygiene. We throw that term around all the time. But sleep hygiene is really just a matter of coordinating how you go to sleep. And we'll talk about some tips that towards the end of the lecture on about how you can get the best sleep possible. And everything doesn't work 100%. However, these tips do tend to help. Restless leg syndrome. Anybody? I don't have it, but I have heard people tell me that it's like a million ants crawling all over your feet, and you've got to move your legs, right? You just have to move your legs. Is that what you find? Not really? You do? Yeah. So the thing is, there are two different movement disorders that we deal with. Restless leg syndrome, I'll kind of talk about them both at the same time, and periodic limb movement disorder. So with restless leg syndrome, you finally get to bed, you're all relaxed. I'm finally in bed, I'm relaxing. Or you're on the couch resting, and you're almost falling asleep. Well, your legs start moving. Or not moving, your legs don't start moving, but you have to move your legs. That's restless leg syndrome. It prevents you from going to sleep because your legs, you have to move your legs or your arms or something. There's this stimulation that makes you need to move your limbs. As opposed to periodic limb movement disorders, you're unconscious. It's not something that you control. So you're asleep, you're laying there asleep, and you move your legs. It's like you run a marathon in your sleep. Well, what happens is you're in these varying stages of sleep, and when you get into a deeper state of sleep or REM, not in REM so much, but these deeper states of sleep, you're going to move your limbs. You're going to kick or move or whatever, stretch or roll over or whatever. Those things really impact you because it's bringing you out of that sleep. So the periodic limb movement disorders prevent you from staying asleep and having a restful night of sleep. And the restless leg syndrome prevents you from going to sleep. Does that make sense? A lot of these things are really tied together, and a lot of what they found is like it impacts women more so than men. And a lot of it is found when women are pregnant, for example. Or they've noticed that women typically have a lower iron level. So that's one of the treatments for restless leg syndrome and periodic limb movement disorders is iron. I'd like to take this time to introduce Ted. Wait, Ted. Ted is one of our managers at our sleep disorder centers. And he is a registered polysomnographic technologist. Shorten it down, he's a sleep technologist. So before he became a manager, he performed sleep studies on people. Did you ever see anybody do all these movements in their sleep?
More often than not. Untreated sleep apnea. You'll see patients tend to kick, twitch when struggling or their body's trying to get them to enter a more normal breathing rhythm, get a full breath of air. So it's another way of the body waking you up out of sleep to remind you, hey, start breathing again. Along with just your basic diagnosis of it. Like Scott was saying, restless leg syndrome is when you're awake. We know what's going on, we're conscious. Not until we fall asleep does that restless leg syndrome diagnosis turn into a periodic limb movement diagnosis. So the separation between the two is basically, are your eyes open or closed? Are you asleep or awake? They can last all night long. Typically, periodic limb movement disorder with untreated sleep apnea can be improved by treating your sleep apnea. So once you start treatment for obstructive sleep apnea, any type of sleep disorder breathing, we see the resumption of we see the periodic limb movement disorder tend to improve and get better with less arousals out of sleep and less awakenings throughout the night, helping you stay in deep sleep for longer periods of time.
Do you remember when I was telling you that as our bodies age, that collagen is not as present, things get a little bit more loose? That's basically what happens in this particular situation. When you're laying on your back and you're asleep, or you're about to go to sleep, you're alert and you're breathing, your airway is open. But as you get into these deeper states of sleep, your tongue and your airway falls back. So what I like to think about it is kind of like this. You're breathing and this is your airway, right? And you're breathing, right? And then as you get more relaxed, this turns into this where it's touching. What do you think happens when it's touching? That's when you snore. Anybody snore? Okay, don't raise your hand on that. We don't want to know. But you snore, and it vibrates, and then you get into this really deep state of sleep. What happens? This turns into this. And you don't breathe. Now in your mind, you're thinking, I gotta breathe. And you're going, you're trying to breathe, but your brain's like saying, you got to wake up and breathe. Because what's happening is your oxygen levels are dropping, your CO2 is rising, and so then your brain finally says, enough, you've got to breathe. And it goes, you gotta breathe, Scott, breathe. And then your brain kicks in and you go, and you start that hacking and coughing. That's obstructive sleep apnea. And there are other sleep apneas that we deal with all the time. And one of them is central sleep apnea, where you just stop breathing for no reason. But that's for another lecture. So what do we do for that? Of course, we treat these patients with sleep apnea, right? There's a mask you can put on, it puts pressure in there, and it opens up your airway, and it never collapses. Sleep apnea's not for everybody. There are so many other treatment modalities for folks with obstructive sleep apnea. However, it's not without risk, and there are many types, but there's different masks and different machines that you can use, but most people tend to use CPAP. So those are the basic sleep disorders that we're seeing in our sleep labs that we test for. So The one thing now that I'd like to get into just quickly is how the mind, medical issues, and medications affect sleep. At the age of 65 and older, that group of people has grown by a third. It's supposed to grow to nearly double, 95 million people by 2060. We've talked about this a little bit, but advances in healthcare have extended our life well beyond what we used to have. So what we're doing is we're getting older with multiple chronic conditions. Diabetes, osteoporosis, asthma, COPD, all these things can kind of multiply and get on top of each other. And that's called multiple morbidity. Multimorbidity. And that creates complexity in the patients that we're seeing as we get older and as we age for individuals, physicians that treat the elderly. There's a geriatric syndrome that is referred to as that the aged have this issue with sleep disturbances because of all these things. And that's because all these cumulative disease issues that they're having really are impacting their sleep. We were talking just a little bit ago. Your hip hurts, your leg hurts, you're worried about your grandchild or your shoulder, or you have urinary issues that you have to deal with. All those things make up a huge impact in the amount of sleep that we're able to obtain. So they attribute to all the problems that we fall that keep us from being able to sleep well. And if you think about it, this is kind of a whole look at all the things that impact our sleep-wake cycle. If you look at the host factors, age, neuropsychological phenotype, meaning what our kind of mental makeup is, sleep-wake hygiene, we've talked about that multiple times, activity pattern, and responses to stress. Those are the host factors. Then you throw on environmental factors. Do you live in a noisy area? Is there a lot of light? Is the temperature regulated well? What's your bedroom environment like? What about disruptive schedules? Medical care. In the hospital setting, there has been a real huge push for healthcare providers treating patients in hospitals to really schedule those beds appropriately so that they're allowing the patients to get as much sleep as possible. And that includes personal care, bathing and toileting and things like that. Social interaction, sleep schedule. Then there's illnesses, all the things that we've talked about. The medical problems, the psychiatric problems, cognitive problems, medications. There are so many medications that impact our sleep as well. We're running a little short, so I'm going to move ahead. But all of these mental health conditions dramatically impact our sleep. One of the things, so again, the depressive disorders and the anxiety disorders, it's cyclical. If you're not getting enough sleep, you're going to be more depressed or more anxious. And if you're more anxious and depressed, you're not going to get enough sleep. So you really have to see someone in a situation like that. The bipolar affective disorders, there's all these issues about the manic phases that prevent you from going to sleep, and then bereavement and grief. We lost my mom a couple of years ago, and it is now 2 years, and my father still struggles in his sleeping patterns. So that late in life bereavement and grief dramatically impacts how we deal with sleep. He hates to go to sleep. And we've talked about medical issues to some degree, and there's just a few on here that I want to talk about. We talked about the chronic pain, the cardiovascular disease, respiratory conditions, COPD, asthma, bronchitis, those types of things prevent you from being able to relax and go to sleep properly. Endocrine conditions, the diabetes. 30% of diabetic patients demonstrate sleep maintenance disturbances directly related to poor glycemic or sugar control. So if you're not regulating your blood sugars properly, you're potentially going to have problems sleeping. You may have bathroom issues where you feel like you have to go to the bathroom all night. 1/3 of diabetic patients have problems with sleep fragmentation, nocturia, going to the bathroom at night, leg cramps, leg pain, and cough. So first we're going to pick on the women. So one big I can't get it out right now, endocrine issue that women deal with is menopause. I said it, menopause. Don't worry, men get their turn in a minute. So associate that with your hot flashes. One of the prime causes of sleep deprivation in women of age is menopause and hot flashes. Even women who do not suffer hot flashes experience more fragile sleep. And it's that menopause age that starts really the ball rolling where women have a difficult time sleeping. Not all women, but some women. Estrogen replacement has been shown to improve sleep habits and the ability for women to sleep. Genital urinary symptoms. It's men's turn. The prostate. I said it. Men, as they get older, they have BPH, benign prostatic hypertrophy. And my father has that, and due to genetics, I too suffer a little bit of that too. But what happens is you feel like you've got to go to the bathroom all night. You can't really empty your bladder, and you have this hypersensitivity, and you know it's just an issue that men deal with as they get older. So one thing that I found very interesting, 2 voids per night is seen in about 8% in 20-year-olds to 34-year-olds. 56% of all men age 75 and older get up at least 2 times a night. So suffering with that kind of an issue and having to feel like you have to go to the bathroom, and then you go and you urinate very little is just a problem that needs to be addressed from a medical perspective. Chronic kidney disease. Folks on dialysis have a hard time sleeping. And then there's the gastrointestinal conditions as well. Those, that's predominantly GERD, gastroesophageal reflux. It typically bothers people during the night. That's why it gets kind of lumped into all the sleep discussions. There's medications. The categories of the drugs we all take as we get older promote daytime. These things promote daytime sleepiness. That's not good. They activate the central nervous system, which means that you're alert. Worse in other conditions, so like your BPH is worse, you're going to the bathroom more, your hot flashes aren't controlled, you're having more issues with your limbs moving while you're asleep. It can exacerbate primary sleep disorders. Maybe certain medications aren't good for, say, your OSA, your obstructive sleep apnea. If you take things that are sedatives, for example, you're going to be a lot less relaxed and need higher pressures on your CPAP devices. And then it affects your sleep architecture. Most sleep providers that we work with do not prescribe a lot of sleep aids. They just don't. Because they feel that patients should really focus on the sleep hygiene component, right? Regimental times of going to bed and sleep, having a routine. Use of over-the-counter medications are notorious for requiring increases in dosage because I gotta go to sleep and you take it. Well, it doesn't work as effectively. So you're upping your dosage and it doesn't work as well.
Something that comes full circle with medications is a lot of the over-the-counter sleep aids that we use tend to also be REM suppressants.
Oh, that's right.
So it suppresses the REM sleep that you're getting, which is your brain's time to categorize and file everything you've seen throughout the day. So if your brain can't do that, it tends to get in a more anxious state and keep you in more of an anxious state because, like Scott was saying, the more you take these over-the-counter sleep aids, the more you have to take them. The more you have to take them, the even less REM sleep you're going to get, leading to a pretty vicious cycle of, oh my gosh, now I have insomnia, and I'm not sleeping because of insomnia, and the sleep aid doesn't keep me asleep no matter how much I take. So then you have to go and speak with somebody about, what was the root cause of this? What is keeping you, preventing you from sleeping?
Did anybody have trouble hearing that? We're all good? Napping. Who naps? I love to nap. Like we've talked about this a little bit. The age-old question, is it normal to nap? The better question might be, what's the probability that daytime naps in a 75-year-old are indicative of sleep-disordered breathing, obstructive sleep apnea, or some other sleep disorder? Not much. You have to have all these other things that kind of pile on that. Or, to what extent does daytime napping adversely affect nighttime sleep? That's a good question. Because if you're taking this big, massive power nap at 6 o'clock at night, but yet you typically go to bed at 8:30, you're not going to be able to fall asleep. You're going to have a hard time falling asleep. Okay, let me rephrase that. Maybe not everybody, but that can be problematic in kind of pinpoint that there's a need to discuss that with a provider or something. But in itself, sleepiness is not an inevitable component of aging. You don't have to be sleepy all the time. Sleepiness is not a part of aging. It's managing your sleep time that improves your ability to have the fullest life possible through the daytime. So what now? When you wake up and you're walking and you feel like a zombie, and it's like, I didn't get any sleep, where's my coffee, I'm so tired. You do not have to live like that. You don't have to live like that. There are ways to work through that. There are providers that's all they do is help people sleep. But the first thing they're going to do, if you walk into see a sleep provider, they're going to get a sleep history on you. They want to know what your typical sleep patterns are like. When do you sleep? When do you wake up? What do you do through the daytime? What do you think normal sleep is? We see people all the time in our sleep clinics that sometimes don't breathe 40, 50, 60, 80 times an hour with obstructive sleep apnea, and they'll swear to you that they don't have obstructive sleep apnea. But they're going to tell you, I can fall asleep at a drop. Well, they don't get any sleep at night because they're not breathing 40, 50 times an hour. So they're going to tell you they don't have obstructive sleep apnea. And then you look at the husband, do you snore? And the husband says, no. And then you look at the wife in the same room and she's going, she tells him, you're insane, you snore all the time. You stop breathing all the time. So the things that they're going to focus on when you see a sleep provider is they're going to get a really good sleep history on you. They want to know everything about sleep and what you think is normal and what you're doing. They'll like to talk to your spouse if you have one. But the things that they'll work on to start with is you'll get information on how to get a good night's sleep. Maintain a sleep-friendly room. What does that mean? You want your room cool at night because our body temperatures fluctuate at night. And I used to think that they encourage you to take a warm shower or bath before bedtime because that heat really kind of relaxes you and gets you ready to sleep. But what happens is our body regulates so that once your body starts cooling down, that's when you sleep well, when your body cools down. And then towards the morning, your temperature starts rising up to wake you back up. Practice proper sleep hygiene. Go to bed, wake up at the same time, every day. Limit time in bed. For our insomnia patients, it's terrible to stare at the clock. It's terrible. You lay there. I got it. Oh my gosh, it's only been 10 more minutes. I've got to wake up in 3 hours. Oh my gosh. And you're so upset about not sleeping that just is going to make you nuts. So what we encourage people to do, stay in bed. You got 20 minutes. If you don't fall asleep in 20 minutes, get up. Start your bedtime routine again. Maybe not take a shower again or a bath again, but get a book. Not the news. Good Lord, you'll never sleep if you read the news or listen to the news. But get a book like a dictionary. Boy, those dictionaries put me to sleep every time. Get outside. Take advantage of the light, not bug light or natural light, but outside light. Because that light really keeps your cycle all in order. It keeps that circadian rhythm all in order. And the world operates during the daytime. You miss opportunities with your family if you're just sluggish in sleep during the day because you didn't sleep all last night. And you want to have the fullest life possible. And so by getting the best night's sleep possible, you're going to have the best day possible. Healthful balance of nutrition and exercise. It's important to exercise. If nothing more than just taking a good walk. Nutrition. Don't eat a big meal, a big fat-laden meal like steak and potatoes and all that right before bedtime. You can have a snack before bedtime, but you want to keep it low carbs and you want to keep it light. Oh, I already said use light to your advantage. I missed that part. Avoid the use of sleeping pills. As I said before, doctors don't like to prescribe those. They want to work on these things, these behavior things. Time to naps with care. Don't take a nap too close to bedtime. It does disrupt your ability to fall asleep and have a successful night's sleep. And manage your medications. Don't take things that are stimulants or that, you take Benadryl during the daytime because you have a cold. Well, you're just going to fall asleep and it'll screw your sleep up the rest of that night. But you want to take things that are less likely to do that. Final thoughts. Aging brings many changes to the body, including sleep. We've all talked about that. Changes to our biological circadian rhythm clock could be responsible for some of those things. Lifestyle factors. They impact our sleep dramatically because they change. Medical illnesses and the medications we take used to treat those illnesses can impact our sleep, so you need to be mindful of that. Let's see. Improve sleep, maintain proper sleep hygiene. And a couple of references here. And then I'm done. No questions? No, you got it. Go ahead.
I just wondered if your sleep position affects whether you have sleep apnea or make it worse. Is that?
It can. There is positional sleep apnea. Typically speaking, when sleeping on your back, there's more pressure spread out across your airway, across your throat, across your chest. When you exhale out, that pressure wants to cause that to flash, including gravity. It's a broader area for gravity to press down on you as well. Typically speaking, it's not too big of a difference. However, depending on the man or the woman, and where the closure in the airway is really happening, is it due to the mandible bone, your lower jaw falling back? Do you have an enlarged tongue? Do you have a bigger bust? Do you have a bigger chest as a man as well? All that, thicker neck, all that can cause You would think they're in amazing shape, but muscle weighs more than fat. That amount of muscle on your chest can cause those extra closures on the airway as well.
But if you sleep on your side,
It's, again, it really depends on the person. We've seen people come in who are severe on their back and do not have any sleep apnea in any other position. We've also seen patients come in that have severe sleep apnea on their sides and are very mild on their back. It's not typically the case. Usually you're always going to be a little bit more severe on your back than you are your sides, but if you test positive on your back, you're more than likely going to test positive on your side as well. But there is a rarity where it's very far in between.
Any other questions? Yes?
Melatonin.
I'm sorry?
Melatonin.
Melatonin. Over-the-counter melatonin. Perfectly fine to take. Doesn't always work. The reason that people take melatonin is because, remember the slide that had the two circles, right, kind of curved together? As the day progresses, melatonin starts building up in our systems, and that's sleep inducing, right? Well, what ends up happening is, if you're surrounding yourself with television and your phone, or your movie, or a lot of bright lights, that doesn't build up fast enough, right? The tips to taking melatonin is to take them at least 2 hours before bedtime. That's what Dr. Trice says, and he's our medical director. He said he encourages people to take melatonin at least 2 hours before bedtime.
Regulate the dosage of it as well.
Yes.
You want to start off with the smallest dose possible, sort of work your way up as needed, but don't get, physicians would hate for you to get too involved with melatonin.
And ignore other things. So you don't want to just focus on melatonin, but not consider the sleep hygiene and minimizing your blue light experiences a few hours before bedtime, or exercising, or taking a big walk before bedtime. Those exercise things. But melatonin's perfectly fine and used all the time. Yes.
Is it possible to do a sleep study without spending the night at the sleep?
Yes. That's a great question. It's called a home sleep test. So there are two types. We didn't really go into any of this. I hate to run over. Is that okay? Just a little bit. There's two different types of tests. There's an in-lab polysomnography and there's a home polysomnography. They both test different things. A home sleep test only confirms or rules out one thing, and that's obstructive sleep apnea. If you're snoring and you stop breathing. An in-lab study, we've got brain waves, we can measure your sleep stages, we measure your chest movement, we measure your limb movements, and it's more definitive of any other problem that you have. So it's important to decide which test to take. We have some doctors that just religiously order home sleep tests on everybody. Even though, no, they need a test, but they should be ordering in labs. And it's because, so with a person that has a cannula in their nose because they're on oxygen, they shouldn't have a home sleep test. They should have an in-lab study. Folks with some mild dementias, they should not have an in-lab study. They should have, home sleep test, they should have an in-lab study. Cognitive impairment where they can't operate the home sleep test device independently. They should have an in-lab study. But some sleep doctors will routinely just order home sleep tests because the patient asks for it. They don't want to say no, and they're doing it from a good place, but it's not really sometimes in the best interest of the patient. Yes?
Can you take one during the day?
Why would you sleep during the day, sir?
You work at night.
Good question. A lot of people work at night, and they come to our sleep department and have their sleep study during the day. We can do home sleep tests at daytime too. So that shift work balance is always taken into account when we schedule sleep testing for patients. Any other questions? Once, twice, Any last, we're done. Thank you all very, very, very much.